able to watch this at a later time will be really helpful for them. So thanks for that, everyone. So I wanted to share a little bit of what the Northern People's Coalition is and what we're all about. So we are labor and community coming together to organize for decent work for all, clean water, mental health and addiction supports, as well as high quality publicly funded education. We are working with the Rosa Luxemburg, who has generously donated to making this training series happen. Together with the support from the foundation, we are now in the part 3 of a skills-based online training series offered over the course of February 2022 to July 2022. Each session will highlight keynote speakers to build up the group's understanding on a specific topic and motivate to employ the skills learned in the training. Today's session is called Northern Jobs, Planning for Our Economic Future, and we are absolutely thrilled to have you here with us today. To continue our organizing and to stay in the loop about our next training, please do check us out on social media. We'll put the different social media platforms into the chat, but mostly if you search at Northern People's Coalition, you're definitely going to find us. We also have a Slack channel, so we'll put those into the chat. As Jordyn had just highlighted, we would like to remind folks about the Grassy Narrows River Run that's happening this year, 2022, and it's happening on Thursday. The link is in the chat for further information. As we had said, with the amazing learning that we had from the several different speakers in the second series, we're really excited to be participating and supporting their efforts for this river run. So we hope to see you there, but there's a lot of other ways that you can support in sharing it on your social media. You know, there's monetary investments that people can make, so please do check out the many ways that you can support that initiative. And I'll pass it over to Aminah to tell us more about today.
Hi everyone, my name is Aminah and I'm residing in Toronto, and I want to acknowledge that we're on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis people. And I wanted to begin by telling you a little bit about what we're doing today. Today, we're excited to be hosting the third part of our training series, Our Movement, Our Fight, and Our Future, with a political education component about how neoliberal policies and power structures are working in Ontario, and of course, the impact that it has had on the North. We hope to expose how the current system we are living in is not working and that a better world is possible. We hope to debunk the right-wing conservative austerity agendas and the continuous attack on working people. We want people to imagine a world that is free from oppression, racist capitalism, colonialism, and destruction. Also, we hope to demonstrate that these right-wing economists and strategists are only deepening the global health crisis that we're living in and accelerating inequalities. After the political education component, we will be listening to a nurse from Northern Ontario to better understand the challenges and struggles living up north under the Ford Conservative government.
Thanks, Aminah. And in order to dive deeper into our topic today, we are thrilled to have Chris Roberts from the Canadian Labour Congress. Chris is the National Director of the Social and Economic Policy Department at the CLC, which is Canada's largest labour central. The CLC is the umbrella organization for 55 affiliated Canadian and international unions, as well as 12 provincial and territorial federations of labour. We also work with over 100 regional labour councils. At the CLC, Chris is responsible for research and policy advice in the areas of macroeconomic policy, labor market policy and regulation, including labor law and employment standards, social security programs, and pensions and investments. He also participates in various federal consultation and advisory committees, including those that have to deal with employment insurance, as well as many others. Please help me in welcoming Christopher to our discussion today.
Thanks so much, Heather. Can you hear me okay and see the slides?
Yes.
Great. Well, what a pleasure to be here. Thanks so much for the opportunity. It's actually quite exciting to be part of this discussion group today, and a very important subject and series of topics that I'm going to try to squeeze into 10 or 12 minutes when these probably could take hours of a discussion, maybe a weekend school in their own right to discuss. But Heather asked me to come and reflect a bit on this notion out there in the media and in public commentary that the right, conservatives, and in Ontario, Doug Ford, are always, everywhere and always, the best stewards of the economy, and that if we only leave everything to them, we're all going to do just fine with have lots of jobs and high incomes, and talk about that myth and where it comes from, lay out a bit of a different progressive or left way to think about the economy that's in direct opposition to that myth of the right-wing stewards of the economy, and talk a bit about the affordability crisis as well. So I've just titled this Investing in Owners or Investing in Workers. Let's see if I can get it to this. So here's a depressingly familiar poll that people may have seen in the Globe and Mail on the eve of the Ontario election, in reporting that Doug Ford is the one leader most trusted to manage the economy. And this isn't particular to Ontario. It's not unusual. In fact, I would argue basically any jurisdiction you look at, it could be Canada, it could be the United States or other countries, the parties of the right are always held up to be the ones that you most trust with pocketbook issues. So the notion that the leader on the right, doesn't matter if they have a track record or not, they could be completely new and have no experience managing the economy. They might have a track record of criminality and business failures as business leaders or captains of industry. It almost doesn't matter. It's just by virtue of the fact that they are conservative or right of center, they somehow inherit the responsibility for economic decision making, or at least the trust of many voters in their capacity to manage the economy. So what that means inevitably is that they are trusted to make the decisions, and usually what that means is that the prescriptions of the right, that is the agenda, the policy priorities of the right, tend to be around things like lower taxes, deregulating and privatizing public services, keeping red tape on businesses to a minimum, handouts and subsidies to industry, creating a sound business environment with lots of incentives for employers to create jobs, etc. So I guess I want to stop and say, well, where does this come from? And I think there is a material basis for it. In fact, it wasn't Rosa Luxemburg who coined this notion, but it was a contemporary of Rosa Luxemburg, an Italian by the name of Antonio Gramsci, who came up with the idea of hegemony, that is, political hegemony of the right, in which our working people's livelihoods are dependent on business and capitalists to succeed. That's a reflection of the direct dependency, say in Ontario, of 3 and 4 workers on businesses to create jobs and generate employment income. That's a fact of the system that we live in, that most workers in Ontario, most people in Ontario, most people of between the ages of 15 and 64 depend on wages and salaries or employment income, and most are dependent on a private sector employer. And just by that very fact gives employers and the right an advantage when it comes to claiming that they know best about how to run the economy. If we just get out of the way and give employers what they want in terms of lower taxes, lower wages and costs for business, less red tape, more support from government, lower minimum wages, on and on and on, they'll create the jobs and generate the investment that will benefit all of us. So that in a nutshell is kind of the right-wing myth. But what is the reality? If we actually look at the track record of conservative and right-wing governments in managing the economy, what in fact do we learn from the data, from the history? Well, there it's a very different story. Back in 2015, when Stephen Harper was running for re-election as Prime Minister of Canada, Conservative Prime Minister, the brilliant economists at Unifor, led by Jim Stanford at the time, who people may know, decided to do a deep dive into the economic record of every prime minister since World War II in Canada. Okay, that's about 9 prime ministers, leaving out Joe Clark and Kim Campbell, who were prime ministers for too short a period to actually examine their track record. And what Jim Stanford and Unifor were able to determine was that if you looked at a number of different variables for the prime minister who was in power during periods after World War II, you looked at their record on job creation, on the employment rate, the unemployment rate, participation rate, youth job creation, etc., but also GDP growth, GDP per capita, investment, all the way down to questions of inequality, household debt, government debt. You could rank the prime ministers in terms of their actual capability and expertise in running the economy for the periods in which they were at the helm of the federal government. And Stephen Harper, who was being set up again in 2015 to be the most assured and respected economic manager that we should entrust our votes to, turned out to be dead last in that entire post-war history in terms of his record. So this was an interesting exercise because it demonstrated if you actually looked at the facts as opposed to what the media was saying, conservatives who like to hold themselves up as experts and economic policy managers extraordinaire actually turned out to be pretty poor. So the reason for this, I would argue, is that the myth behind conservative economic management is that the economy is separate from the activity that we as workers engage in every day. It's somehow separate from the unpaid and paid work that working people engage in day in, day out, and the actual economic activity that they engage in as consumers, as borrowers, and as workers. That's the myth, that if you take the perspective that the economy is us, is our activity, and that it's not separate from that, then you have a very different vantage point on what is sound economic management, and it sure ain't what the conservatives and the right are giving us. I'll give you an example. Until very recently, the notion of spending taxpayers' dollars on childcare was seen in the media and by the right as being a crazy idea that would just be a waste of money. Another example of overspending governments, overtaxing governments that would just act as a drag on the economy and simply lead to higher taxes and less private sector economic activity. In fact, what we know from studies in Quebec, which was the first province to have affordable, general, universal childcare, and now outside the country, but also in other countries, is that investing in childcare in the lives and activities of working people is enormously economically beneficial. A study from, again, Jim Stanford in BC showed that a universal national childcare would create over 200,000 direct jobs, 80,000 more indirect jobs in industries that support childcare centers, and allow up to over 700,000 women to increase their level of participation in paid employment and generate all kinds of increases in GDP over 10 years, In fact, it would generate so much additional revenue and so much additional economic activity that the system, the investments, would actually pay for themselves. That's what the finding is. And that's not Jim Stanford only, that's the IMF, the International Monetary Fund, which found the same thing. Canada could dramatically scale up its investments, and the system would actually pay for itself in higher levels of economic activity and higher tax revenue to the government. That's one example. Another is the fight that we have on now in Ontario and other provinces to win paid sick leave. Again, businesses and employers and the right would say, well, you can't just impose additional costs on employers because they won't want to invest and create jobs. Again, that hegemony that we all depend on private businesses. But again, what's economically rational or effective, efficient for individual employers is not necessarily the best solution for the economy and for everyone as a whole. And this is a good example. It was found through another study that Jim led that in BC, in fact, implementing 10 paid sick days would have a very marginal impact on total business costs, less than half of 1%, as a matter of fact. But in addition to that, the economy as a whole would benefit from the various advantages of paid sick leave, higher productivity from people being able to work while not sick. This phenomenon of presenteeism that we're all familiar with, when people are sick and they go to work, lowers productivity and increases workplace infections. Also, the reduced burden on the healthcare system as a whole, and the government of Canada has recognized this. So another example of how investing in working people can actually have bigger economic impacts beyond an individual workplace. And a final example, although I could add additional ones like raising the minimum wage and other examples into this, but removing barriers to unionization. There's lots of evidence now, lots of research that shows that unions increase wages and benefits and improve working conditions, not just for the workers who decide to unionize, but for non-unionized workers at the same time, because those employers, in order to stay non-union, will raise wages, benefits, and improve working conditions. So there's research that shows the wider benefits of unions. They improve health and safety outcomes, again, for unionized and non-unionized workplaces. For individual employers, they lower employee turnover costs and increase retention, and they reduce inequality. Okay, so I want to quickly kind of move into the final stages of again, a presentation that could sprawl much longer than I want it to. But we're currently in the context of high inflation and very difficult affordability pressures for working people. What I want to stress, and what the consensus is that workers did not cause this inflation. Wages have been rising at half the rate as prices, as the overall price index. It is not wage demands that are pushing up high prices since the pandemic. In fact, what it is high energy costs associated with the upswing in oil and commodity markets, the war in Europe, disruptions, and or so-called supply side effects rather than wage demands outstripping price increases. So wages and workers are not responsible for creating this inflation, but they've been suffering the effects of the affordability crisis, high food prices, high energy prices, gasoline, etc., and high home prices, of course, making housing affordability a major challenge. The government in Canada and in Ontario has not been focused on affordability for the most part. Other countries have, European countries have rushed into place emergency measures to ease the affordability crunch that working households are facing. So fuel subsidies, subsidies for people having difficulty putting food on the table, or have out-of-pocket medical expenses, these kinds of things. Canada has not done that. Instead, it's focused on inflation. And what's now happening is that the Bank of Canada is raising interest rates to essentially drive up unemployment, slow economic activity, and thereby slow down inflation. But this doesn't go to the heart of the issue. And that chart there, what you see is it looks at the total compensation of employees, which is the dark bars, and the basically corporate profits, which is the lighter colored bars, in the recoveries following the last 6 downturns, economic downturns. And what you see in the current one after Q1 2020 is that profits have vastly outstripped total compensation, which has actually been negative, certainly negative in real terms when adjusted for inflation. So it's corporations in part profiteering from supply shortages and disruptions, taking advantage of the recovery to fatten profit margins, frankly. Governments are not doing anything about that. They're not stepping in when the food stores like Weston's, et cetera, Loblaws are making out like bandits and earning super profits, excess profits. They're not intervening to address affordability in that fashion. Instead, what they're doing is clamping down on inflation by essentially crashing the economy. So that's what we're going to get. Well, who benefits from that? Well, owners of financial assets benefit because interest rates are their income. The higher the interest rate, the better banks do, for instance. But those who will suffer are those workers who are laid off, whose businesses or the employers go under, and who suffer higher unemployment or underemployment. So it's essentially forcing workers to pay the cost of something they didn't create. Okay, so that's the solution there. It's incredible that they're threatening a recession barely 2 years into an economic rebound. This will only expand joblessness and poverty. It will squeeze indebted households because, of course, we pay mortgages based on the central bank interest rate. And it will do little in the short run to reduce food and fuel inflation pressures or the affordability crisis. So that's really what I wanted to say about affordability and the Conservative track record on managing the economy. I'm going to end here with a question I don't have an answer to, but I'm sure Heather and the other people on this call do. So thank you very much.
Thank you so much, Chris. That was absolutely wonderful and such an incredible overview. I mean, there were several points that you highlighted that speak so true to what every worker is experiencing today, that the price of gas, groceries, and housing are further and further out of reach. And as you said, corporations are seeing this moment as a time to profiteer, to gouge consumers to the extent that we're seeing today. And, you know, as you also spoke towards that, the government isn't focusing on clamping down on these corporations charging us these prices. Instead, they're looking to the banks to increase interest rates, which again will hurt working people. So as we move into our discussion a little later on in today's event, we'll discuss some of the ways that we can come together as a team to help call the government into account for what's really going on. And also the overview for what's been pumped into society. We're going to look at a page together today around the myths that Conservatives are good at the economy and why these are being, are a failed belief, and it's clearer and clearer by the day. So again, I just wanted to thank Chris, and also if folks, we have a couple minutes for Q&A with Chris. So if anybody has a question, we'd love for you to have an opportunity to ask it.
I can ask a question. Oh, and then Jordyn. Well, that was really helpful, Chris, and thank you for joining us. I wanted to ask you, what do you think, would help people in Ontario understand, these type of right-wing economics, because we're seeing people like online, people are calling to question Rogers and Air Canada, and people all over the spectrum, are talking about like how monopolies are, controlling, and people are talking about the bread prices, and they understand that. They do understand, but what they're not understanding is like the alternatives. So how do you think, as an economist and as someone who works at the Canadian Labour Congress, what do you think would help us like educate and inform and create alternative ideas that like you were talking about today, and understanding that there can be solutions through the unions and through working people?
It's an excellent question. I can offer maybe two quick gestures to an answer. As people see the failures of, our very highly concentrated industries, with like in telecoms, and Rosa Luxemburg wrote extensively about concentration and centralization in this respect. I think what they're seeing is a microcosm of what we've been talking about. A notion that if you just leave it to private industry, they'll deliver the goods. Well, that's clearly not the case. They clearly failed. I mean, and people have been pointing out that this isn't just some, your corner store. This is like the infrastructure for our health system, for 911, for everything. Like, this is serious stuff. Essentially a service that should be considered a public utility. It's a public good that we all rely on. You have to have the internet today. It's a fundamental part of our economy for security reasons, health and safety, you name it. And given that it's a public good that's being delivered by private for-profit providers, we ought to, at a minimum, have a public sector anchor. And other countries do this. They have a public not-for-profit provider that acts as a competitive pivot for the entire industry. If you want to operate in that industry and try and make a profit, you have to compete with the low-cost public sector provider that's going to deliver high quality services to everybody. And if you can do it, great. But everybody, all of us consumers, we have the option of going to the public sector provider. So that's what I think labor should be talking a little bit about, and not just in telecom, but in banking, which is also a public utility, right? I mean, the financial system should be thought of as a public utility in part. So if we can't nationalize the whole thing, then let's have a public sector anchor to keep the corporations honest. That's the first thing. The second thing I would say for unions and the economy, thinking differently, is the key role played by the public sector. The public sector is absolutely critical to local economies, and we have to stop thinking of it as a drain on private sector activity, but it is the engine of private sector investment. You go north in Canada. I just heard today that the Northwest Territories, I think, has 4 ICU units or something. Unbelievable crisis in healthcare in the north. Say nothing of what's happening in the south. If you could invest in public services like health services, attracting and retaining trained professionals, nurses, care aides, all the people who make up a strong care infrastructure, then you're going to attract private sector investment. You're going to attract all sorts of business activity. And that acts as the node, the core for developing economic development, basically. If you start with the twisted idea and wrong idea that the public sector has to be shrunken and impoverished and diminished in order to get private sector activity, you're never going to get it.
Thank you so much for that, Chris. And we've got one more question here with Carlos.
Thank you, Heather. Oh, Chris, during this conversation, it was coming to my mind the fact that the Canadian bourgeoisie control the mass media, television, newspaper, that have national coverage. My question is, do you think that the role of the mass media played a role in perpetuating the notion that the conservatives are the best stewards of the economy? And the question is how we are going to counter attack that notion, because really in every single federal or provincial election, they are coming again with, we are going to be the best steward of the economy, but we don't have access to the mass media in order to put our point of view forward. What do you think is going to be the best action that we should take as activists, as union leaders?
Well, that's a very difficult question. I'm hoping Heather and Kim and others on the call have better ideas than I do. I mean, I think public broadcasting, for the reasons you've pointed to, is critically important. Media that can conduct honest, investigative, critical journalism that isn't simply driven by the profitability requirements of mass commercial media is really key. Unfortunately, in Canada, CBC and other public outlets, as important as they are to defend and to reinforce and expand and reinvest in, they all too often they adopt the worldview and the mindset of the commercial capitalist media, and so they're not always performing the role that we need them to perform. So what can unions do? Well, I think union education and union writing and publishing is really important as well. We have to obviously engage with the right wing, typically, or commercial media, mass media, but we also have to find ways in and around it. And I think using new media has been very effective, and other ways to get at new workers and unorganized workers to get our message to them. Beyond that, Carlos, I don't really have many very good ideas, I'm afraid.
Thank you, Chris.
Thanks for the question and the response. And just on that, Chris and I and many others at the CLC have been having these conversations and really thinking about what campaigns could look like in order to address this, because as Aminah has said, as so many others on this call have said, this is what the Conservatives go to every frickin' election. So until we can show that there's a different way and use our means of communication, as Chris just laid out, in order to show a different way and that it is possible, and what we fight for every single day as people and workers within the economy, that's it really is top of mind, with the affordability crisis being further and further out of control. So thank you for that, Carlos. All right. Well, thank you for those questions, and I'm super excited to be hearing from Dawn next as a worker up in the north. So I'm going to pass it over to Aminah to introduce her, and we are absolutely thrilled to have her. So I'll pass it over to you, Aminah, to introduce our next guest.
Yeah, thank you. And I want to thank Dawn for joining us last minute. I know it's the summer and it's just a period of everyone's just relaxing. So thank you. Dawn Armstrong is the Vice President of Region 1 for the Ontario Nurses Association, which includes districts of Kenora, Rainy River, Thunder Bay, Algoma, Temiskaming, Nipissing, Cochrane, Manitoulin, Regional Municipality of Sudbury. That is a lot. And so thank you so much. She also oversees the portfolio of human rights and equity. ONA is a union representing more than 68,000 registered nurses and healthcare professionals, as well as 18,000 nursing student affiliates, providing care in hospitals, long-term care facilities, public health, the community, clinics, and industry. And we're just really grateful that ONA was able to collaborate with us and join us today. We were trying for the whole summer, so we just appreciate you all here.
Thank you so much, Aminah. Hello, everyone, and good afternoon. As mentioned, my name is Dawn Armstrong, and I use the pronoun she, her, and I come to you from the traditional territory of Anishinaabe, recognized by Treaty 3. I am a proud registered nurse for over 30 years, and as mentioned, I currently am the Region 1 Vice President of the Ontario Nurses Association, and I represent all members from Sudbury all the way to the Manitoba border, and I proudly hold the portfolio of human rights and equity. I've spent my entire nursing career in Dryden, a small northwestern town, and I can certainly bring the perspective of our nurses working in the north. I want to start by thanking the Northern People's Coalition for organizing this event and inviting me to speak on behalf of ONA members. We are at a critical moment for our healthcare and public services more broadly. The decisions made now will impact the future of our economy, our working conditions, and our care. In the North, we have a crisis in healthcare staffing like we have never seen before. This situation is hurting healthcare workers, but more importantly, the patients, residents, and clients they care for in their own communities. I heard from ONA members in Dryden just last week. A unit that would normally have 5 RNs had 2 RNs on duty to cover 40 plus beds. And although we know that this is happening in the South, the uniqueness in these small rural hospitals is this. The patients they care for in these areas cover medicine, obstetrics, pediatrics, surgical, alternate level of care. The complex care patients normally cared for on this unit required movement into our ER so those specialized nurses could look after their needs. But all that does is then place the burden elsewhere, perpetuating the concept of robbing Peter to pay Paul is okay. This example certainly highlights the stark reality of what is happening in my workplaces. We have members working 24-hour shifts, being denied vacation, required to do excessive overtime, and working short every single shift. And yet this government passed a law, Bill 124, that unfairly caps wages for public sector workers at 1% for 3 years at a time when they are being asked to do more than ever. And although the public want to believe that it is about money, it is not. It is about respect. It is about going to work and having a manageable workload where RN and healthcare professionals can work within their standards and provide exemplary care. It's no surprise we are seeing widespread mental injury, and it's clear that the reason is not individual inability to cope. Last week, I watched one of my members openly on Facebook admit to her own struggles and directly relates it to a broken system. I cried. I cried along with her as she shared her struggles with people within her own community on the Facebook. In response to this crisis, we're seeing employers and governments turn to a casualization of work as the answers. Challenges with healthcare retention and recruitment are not new to the North, but are becoming increasingly more difficult. Other opportunities provided to RNs where the work-life balance is better compounds the exodus of staff from our hospitals, long-term care, and community care. Yet instead of investing in hiring more full-time nurses and healthcare workers, creating nurse-to-patient ratios that are equitable, the trend is to rely on part-time, casual, and worst of all, agency nurses who don't receive benefits or sick time. Agency nurses do not have pensions. In my career, I've never seen as much casual and agency nurse use as I am seeing today. In one hospital in my region, agency nurse is over 70% of the workforce. That is not sustainable. Governments and employers are creating crisis in decent work, which is creating a crisis in care. The failure to invest in permanent, full-time, decent jobs erodes the quality of our public health care, risks patient safety, and creates even more strain for nurses and healthcare workers, and it is driving nurses away from care work. Not only that, but this model is more expensive and leading us down a path of privatization. Agencies are profiting off our public healthcare system while conditions of work and care only get worse. So how do we win? How do we build capacity in the health system? The answer is organizing. We need to organize our workplaces and communities to build momentum for decent working conditions, high quality public health care, and real action to end the health staffing crisis. Although it may have sounded gloomy up till now, the North is a great place to be a nurse. Nurses here get to take on more responsibility, practice using all of our expertise, and continue to build on the education they received in nursing school. Because our healthcare facilities and hospitals are smaller, we build strong bonds with everyone in the hospital, from other units, the dietary and custodial colleagues, and everyone in between. This sense of community is an amazing resource to draw on. For the future of healthcare work here in the North, we need to fight for safe staffing and patient ratios and prioritize recruitment to catch up. We also need to focus on retention, keeping those RNs with the knowledge to mentor and foster the new generation so they feel supported and want to stay. This is so important because our staffing here was already lean due to years and years of government neglect. We need to get rid of Bill 124 and pay nurses and healthcare workers and all public sector workers a decent wage and invest in retention. We need to bring back retired nurses and offer opportunities to late career nurses to work as mentors, supporting these new nurses and make it so much easier for RPNs to bridge to become RNs. We need to protect and preserve our northern universities and colleges, increase the nursing seats within, and provide incentives to stay here to practice post-education. We need to make it easier for internationally educated nurses to get licensed. We have thousands of qualified nurses out there caught up in red tapes and delays. And particularly here in the north, we need to invest in Indigenous healthcare models and providers and root out systemic racism in the healthcare system. This is the path that will build a truly public healthcare system for the future. The conditions of work are the conditions of care. What gives me hope is that nurses and healthcare workers across the north are fighting back. Our members are mobilizing in their workplaces and rallying in the streets against Bill 124. During the election, I want to encourage our members and all Ontarians to vote in our sharing interests. We ran a strong campaign against privatization and in support of repealing Bill 124, investing in safe staffing and models of care, and prioritizing the social determinants of health. In the north, our members made over 4,700 phone calls to talk to their colleagues about using our political power to fight for the healthy communities and workplaces we need. We all need to work together across sectors because we all need public services for our future. I so appreciate the Northern People's Coalition for bringing us together to build solidarity, to support each other, and imagine how we can take action together to protect public services. Investing in staffing with decent working conditions and fair wages, with enough nurses and healthcare professionals to support a manageable workload and safe care conditions is the only solution. This is the only way forward to recruit new nurses, keep nurses in their jobs, and stop a system-wide collapse. And I know that collapse is a strong word and not one we in the healthcare sector take lightly, but that is where we are headed. We can have a resilient, sustainable, equitable healthcare system in the north. We can have strong local economies built around decent work. Sustainable care is the future of our economy. This is the vision we all need to fight for together.
That was wonderful. Thank you so very much, Dawn. That was such a, the overview of the complexities of what it's like to work in the north as a nurse, and also the hopeful aspects of the campaigns that you've all been working on, and that sense of camaraderie and community that exists in the north. It was such an incredible overview. So I'd love to open it up to the floor if folks have questions for Dawn. Seeing bravo in the chat, right?
Thank you, Chris.
I'll ask something. I thought it was very interesting. I didn't know that a lot of the work is going towards agencies. So how, so the agencies are for profit? I just wanted to clarify.
Yes, so these are these are private agencies that support nursing or provide nursing staff to communities who don't have enough of their own staff. As I mentioned, I've been a nurse for 31 years. I worked at Dryden Regional Health Center for most of my career until I took this position. I've never worked with an agency nurse my whole time there. Now I will tell you that on any given day, we have 3 to 4 agency nurses in our facility all the time. I work and speak with all the leaders within Region 1, and it's the same thing. They have never had agency nurses before, and now I would bet almost every single one of my workplaces have agency nurse use. And the problem with this is that it pits the public nurses against the private nurses because they're working side by side. They're doing the same work, but they're not getting the same pay. Plus, they're costing our system, way over. So where a regular nurse would be getting $30 to $40 an hour, the nurse beside her is getting a wage above that. Plus, you're also paying a fee to the agency to provide the nurse. And as well, in most of our collective agreements in the hospital sector and the long-term care sector, if a hospital or a long-term care home uses above their hours of agency nurse uses, they then also have to pay a penalty to the union. So that, again, that is coming out of the global budget of the hospitals. And we know where the global budget of a hospital comes from, the public, from us. So that is public monies that is being used to continue to, profit private sectors, and it's just not right.
You raise such an important point, because one of the things that's going to be on this little one-pager mythbuster I'm about to share is how the conservatives paint privatization as giving you options, when really how much the public sector is paying for these privatized elements within our healthcare system. It is completely draining, and obviously creates a much more vast division between those with a lot of money and everyone else. So definitely lots to fight for there. So thank you for using that really clear example. Any other questions?
Sorry, to add to that, I had a meeting with Frangelina last week, who is the NDP MPP for the Greater Sudbury, and she is now, of course, the health critic for the NDP government. And I was always under the impression that we talked about media and using media. Carlos was saying earlier, and I always thought the answer was getting out to the public about how terrible our system is. But the more we focus on those stories where your mom is not getting her surgery, or your dad or your grandpa is having to be in the hospital because there is no home care available for them, is actually adding to the Ford agenda, because he's going to do exactly what you just said. He's going to say he's ready to go. There is something better out there. So the more the public outcries, so she said what our message needs to be is to continue to inform the public that they are going to lose their publicly funded system for private, not to focus on the stories out there, but to focus on the aspect that we are going to become a have and have not society. So those that have and can pay are going to get, and those that have not are going to be left even farther behind than they are now.
Thanks for that, Dawn. That is so true, because conservative governments, they bleed these systems dry so that they can say, look, it's not working, introduce what they call options. So I just couldn't agree more, Dawn, that you're so bang on that. The story is not what isn't working, it's what the real choice is.
Yeah. Yes, exactly. What can work so that it is sustainable for everyone.
That's great. Any other questions for Dawn before we move on to the final aspect of our gathering here today? Okay, great. So I wanted to share with everybody a document of some myths that tend to circulate every single election around conservatives and the conservative right-wing agenda when it comes to economics. So I'm going to share this one pager with everyone, and then considering that this was just supposed to be a 1 hour kind of lunch and learn kind of situation, we're getting very close to the end. So we're just going to spend 5 minutes in two separate groups to talk about a couple questions that Aminah and Jordyn and I all created together to get our mind around what we're seeing, what we've discussed here today, and what we want to do moving forward. And I'm just going to take a moment before we go into our separate rooms to say thank you to our speakers. I personally got so much out of everything that you shared, and I think I speak for everyone that we all did. And we did get quite a few folks that really wanted to be part of this conversation but are away. So I know that the recording of this will be really impactful for a lot of people. So thank you again for that. So I'll share my screen, and we can take a look at this. There we go. My computer is freezing up a little bit.
Heather, would you like me to share?
Sure, that would be great. Oh, I got it.
Oh, okay.
All right, so give me 1 second. Sorry. There we go. Nice black. Okay, so can everybody see that? Yeah. All right.
Yes.
I feel like I want this on a t-shirt that just says like conservatives are not good at the economy, so that we can, everywhere we go, you know, we're like walking, you know, left-wing propaganda, not propaganda, but anyways. So these are, I'll just go through the different myths, and then it's just for you to think on before we go into our little divided group. So myth one, you know, that the conservatives create access to good jobs, and conservatives claim that we are open for business. Given, you know, what we heard today, and I'm sure what many of you have experienced in your lived experiences, is that wages are stagnant, especially as Chris said, in comparison to the rate of inflation, that precarious work is on the rise, and job security continues to get further and further out of reach. That is an economy that's working for anybody, maybe except for the 1%. Myth two, inflation. So the conservatives claim that paying workers a livable wage drives up inflation. I don't know how many times I've heard this on the doors when I'm knocking for the NDP, that you can't raise the minimum wage or it's going to blow inflation out of the water. Again, you know, we've seen most recently that while inflation is on the rise, that wages are stagnant, so that hasn't been the causation. And it's happening while big corporations are making record profit. The third, and as Chris said, you know, profiteering from the circumstances. So myth three, the cost of essentials, so gas, food, well, maybe energy, you know, as we move to more sustainable solutions, and housing. The conservatives claim that the pandemic and workers' wages are to blame for the rise. And the reality is that corporations have profited from price gouging during the supply shortages, and that right-wing economics does not hold corporations to account in what they charge consumers or patrons. And then the fourth, which I know we all fight against a lot, is the myths around privatization. As we had talked about previously, that conservatives claim that privatization gives you options. In reality, as Dawn, you just so well articulated, it does not provide better quality of service, especially when we're looking at aspects within care work. Profits go straight into the hands of stakeholders, and they don't improve care or the lived experience of workers. And then secondly, that privatization furthers the division of access, you know, whether that's access to good education, whether that's access to healthcare, so many different areas where privatization, you know, we're already feeling it creeping in more and more. So those were some of the ones just to kind of get our juices going. So we'll just take I'll ask Erin to separate us into groups, and just feel free to stay in your groups as long as you can. I'm going to bid everyone adieu, and thank you so much for joining us today. A huge thank you to everybody who made this possible. To Erin, he's been wonderful. It's been a joy to work with Aminah and Jordyn. So thank you everybody for joining us today, and enjoy your discussions.